Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local health professionals discussing health topics of importance to local residents. Today, we're back in the ATMC TV studio, and we have a great show planned for you. Orthopedic surgeon Dr. Thomas Kelso will talk to us about Brunswick Novant Medical Center's new orthopedic operating table. And then Deborah Rochelle, the hospital's manager of volunteers and service excellence, will join us to share information on the guest services offered at the new hospital, as well as information on the volunteer program. Stay tuned to learn about valuable health topics with Health Watch. Our first guest is orthopedic surgeon Dr. Thomas Kelso. Welcome, Dr. Kelso. It's good to have you back on the show.
Well, thank you, June. It's nice to be here.
Well, good. Before we get started, would you mind telling our viewers a little bit about yourself?
Sure. I'm an orthopedic surgeon. I've been in practice for almost 15 years now and relocated to this area almost exactly a year ago. In fact, it was a year ago to this week that I started practicing here.
So we're celebrating your anniversary.
My 1-year anniversary in Brunswick County.
Awesome.
That's great.
That's awesome. Tell me a little bit about your practice here at Orthopedic Specialists.
Yes, we do all kinds of orthopedic surgeries and take care of all kinds of orthopedic problems with our practice. We do a lot of work with people that have shoulder problems, hip problems, and knee problems. And I do a lot of arthroscopic surgery as well as joint replacement operations. And we really try to focus my interests in shoulders, hips, and knees.
Shoulders, hips, and knees. Probably have a lot of business here in this area where there's a lot of golfing and tennis and things like that.
Yes, especially with with a population that's sort of in retirement age, and they're very active, and they want to continue to
stay active.
Yes, they want to continue what they like to do, and it's sort of my job to make sure that they can continue being as active as they want to be for as long as they want to be.
Well, good. Well, and we're glad that you're here. Well, along with opening a new facility, I'm aware that Brunswick Novant Medical Center has also upgraded its orthopedic equipment. And I understand that they've added something called the HANA table. Dr. Kelso, what exactly is a HANA table?
Well, a HANA table is a very interesting device that helps us with a certain type of hip replacement operation. The table itself is a type of surgical table that allows us to position an individual's body in such a way that improves our ability to get exposure to a joint during an operation. It helps us if we were taking care of, say, a person that needed a hip replacement. We would have them, after they go to sleep, they're usually not awake when we put them on the table.
Right.
But after they go to sleep, we transfer them from the hospital bed onto the table. Their feet are actually put in custom foam padded boots, and then these boots hook into the table so that we can then independently manipulate their legs and put them in the proper position so that we can then perform surgery in the optimal manner. And particularly when it comes to hip replacement surgery, it's a very helpful device.
I see. And what about benefits to the patient? It sounds like it would be great positioning for you, but do the patients actually receive a benefit from that table also?
Well, the primary benefit is that we're able to do an anterior approach to the hip. Now, hip replacement surgeries have traditionally used 3 different surgical approaches to put in the new components. Either a direct anterior approach, which is sort of it's a way that's gotten increased use in the last 5 years or so, but it's been around for many years, but it's sort of been a lot of new interest in using an anterior approach has occurred in the last 5 years. But other surgeons prefer to use either a lateral approach, so that we would make the incision on the side of the hip, or a posterior approach. The benefit of using the anterior approach is the patient's laying flat, so we can get to that helps in their anesthesia delivery. So
oh, I see.
that's one of the things. Number 2, by going through an anterior approach, you don't have to detach any muscles, and minimal muscle tissue damage occurs during the surgery. Essentially, we're able to make an incision through the skin, place some retractors in appropriate positions, and gain access to the hip joint directly without taking down tendons or damaging muscles. And it's been scientifically shown to create less muscle damage as a result. The benefit here is that it has less postoperative pain. The real good major benefit of it has been shown to have increased stability, so the risk of a dislocation after the surgery of the ball and the socket components is greatly reduced. Some estimate as much as 20 times lower. And then finally, because of the position of the patient laying flat on their back, we're able, and also because of the design of the table, we're able to bring in a C-arm, which is an X-ray imaging device that allows us to get images of the position of the components as we're inserting them into their final position. So this allows us to accurately make sure both of the patient's lengths are properly restored, and then also to make sure that the angle and position of the cup and the ball and the stem are just the way we like it. So, you know, basically we can put in almost perfect alignment of the components by using the HANA table and the C-arm.
Well, it sounds to me like there's significant benefit then to the patient.
I think there is. I started doing the anterior approach about 3 years ago, and I converted from the lateral approach, or the approach from the side, largely because I felt my patients were having more postoperative discomfort than I wanted. They would limp because I would have to take down part of one of their tendons, and they would have to repair that as we finished the operation. But it would cause some weakness and a limp. And after I saw the results from using the anterior approach, I just completely stopped doing the lateral approach. I don't want to do it anymore.
Really?
Yeah.
Really?
So I've been very pleased, and my patients, I think, have been very pleased as well.
And then through using the HANA table, that makes the anterior approach doable and much easier, it sounds like.
And it's been, actually, some people consider it they think of it as a surgical instrument.
I see.
I mean, it's an important, integral part of getting the proper exposure. It has a couple of other devices that allow us to get really improved exposure to the proximal femur during the operation that we wouldn't normally be able to achieve without the HANA table.
I see. Well, I'm curious, are all candidates for the traditional hip replacement, are they candidates for the anterior procedure?
Yes, there really is no reason that any person who is a candidate for a hip replacement wouldn't be a candidate for the anterior approach.
Great, great. And do you expect that most hip replacements will be done using the HANA table in the future? Do you think that's the way of the...
This is a very controversial sort of...
really?
Because I mean, obviously there's a lot of people that don't want to change the way they've done it. I would say worldwide, I think 70% of hips are done through a posterior approach. About 20% are done using the anterolateral. And then the smaller segment is the 10% remaining for the anterior approach. Although I think a lot of people are changing the way they do it, and a lot of younger surgeons are getting trained using an anterior approach. So in the future, I think the percentages are going to shift in favor of people doing more anterior approaches, particularly as people start to see the benefits of this type of technique.
I'm curious about the feedback that you receive from your patients after having this anterior approach or using the HANA table. Do you receive good feedback from your patients?
Yeah, I mean, like I said, that's the reason I've completely abandoned the old way I used to do it, because the benefits and the feedback that the patients give me are overwhelmingly positive, to the point where I don't want to use the older technique. At least in my hands, I think my patients get a much better result using an anterior approach, and you know, other people are comfortable and satisfied in the way they do total hip replacements. And it doesn't mean you can't get a great hip replacement from one of the more traditional approaches, but in my hands, I prefer to use just the anterior approach, and that is largely because of the positive response from my patients.
I'm curious, are there any other special features that the HANA table offers? Can you do any other kind of surgery on the HANA table?
You can. It's not just a surgical table for hip replacements. It's actually a modified special type of what we call a fracture table.
Oh, a fracture table.
And so patients that have fractures of their thigh, particularly like a femoral shaft fracture or a certain type of hip fracture, we would use the HANA table to help repair those fractures as well. So it has multiple uses other than just using it for a hip replacement.
And so you're currently using that HANA table at the Brunswick Novant Medical Center, correct?
Yes, we're very pleased that we've been able to get that in, and you know, it's just a big improvement for us.
Great, I'm glad to hear that. On a slightly different topic, I've also heard about a new type of knee replacement, and it involves using an MRI, I believe. Can you tell me more about that?
Very interesting sort of evolution of the way we're doing total knees. This is, we're using either an MRI scan or in some instances a CT scan to take preoperative images of the patient's knee. We also take a couple of images of the hip and the ankle. And then we're able to, through computer, getting the information from the MRI scanner uploaded to a computer, we can create a three-dimensional image of the patient's knee and also exactly preoperatively determine the alignment that we need and how we're going to do the operation. In fact, we use the images to actually make a model of the patient's knee so that we can custom make the jigs that we use for proper alignment during the surgery. We have a couple of examples here. This is just a patient model of the end of a patient's knee, the femur and the tibia, and they would normally anatomically fit together like this. But you can see that these are actually the cutting jigs that would be used in the person's operation, and they would be fit so that they would fit exactly perfectly fit onto the patient's bone. So this would be the patient's anatomy. That way we could drill these holes perfectly so that then we can then.
So it's like a template.
This is a custom-made template made specifically for a patient that most precisely determines their anatomic alignment. We're able to preoperatively determine the exact size of the component to best fit their anatomy and exactly where we need to make all of our surgical cuts and releases to optimize the position, the position of the components for the patient. So I really believe in the next 5 or 10 years, total knee replacement is going to move to this sort of preoperative planning to help eliminate a lot of some of the intraoperative guesswork.
Now, do you currently perform that at Brunswick Novant Medical Center? The MRI guided?
We are I've done them before.
Yes.
And we're currently getting our new MRI scanner set up so that we can get the information from the patient scans and have these models made. So I anticipate that within the next couple of weeks to a month or so.
Oh, wow, that's soon.
It's being worked on just as we speak today.
Great. Well, that sounds like a wonderful process, and it fits so perfectly. I just couldn't believe how that was so exact.
That's why we do it. That's why we make that model, just so that we can make the jigs perfectly fitted for the patient.
Yeah. My husband always says, measure twice, cut once. And so that reminds me of that sort of,
You can't measure too many times, really. That's an important cut you want to make, right?
That's right. Well, before we wrap up, tell our viewers how they can make an appointment with you.
Well, you can call our office at Orthopedic Specialists. I have office hours. We have a clinic now down in Sunset Beach.
Right.
So you can see me there. We have an office in Supply, and even over in Southport, I go once a week. But just call the office and ask them to set up an appointment with me. I really boy, I want people to know that they don't have to go travel far distances
That's right.
to get quality orthopedic care.
No longer.
You don't have to go to Myrtle Beach or go to Wilmington. We
Right.
have excellent care here.
We do. We have excellent care offered here in Brunswick County. So it was a pleasure having you on the show today. I thank you so much. It's been very, very informative, and I look forward to seeing you again.
Thank you, June. Appreciate it.
You're welcome. Our next guest is Deborah Rochelle, Manager of Volunteers and Service Excellence at Brunswick Novant Medical Center. Deborah, it's so good to have you on the show today. And for our viewers out there who have not met you previously, tell us a little bit about yourself, what you do at Brunswick Novant Medical Center.
I am the volunteer manager. I'm also responsible for Service Excellence, the chaplaincy program, and guest services.
That is a lot.
It is, but I enjoy every bit of it.
Well, that's good. Well, how long have you been with the hospital?
I was at Brunswick Community Hospital for approximately 10 years and now at the new hospital for about 2 weeks. Yay.
Yeah. Well, I know you're excited about the new hospital. I think everybody in town is. How has the community responded thus far?
Well, I think I have a good perspective of it, especially with having the guest services
Yeah, sure.
at the front door. And everyone that comes in, they talk about what a beautiful hospital it is and how great it is to have it in this community.
Oh, I would love to see some of those responses as they come through that front door. I imagine they're just sort of taken aback.
They are. They are. It's a beautiful facility.
Well, I'm sure that our viewers are interested in learning more about the hospital's new guest services department. Tell us about that.
The guest services department is new. We're at the front desk, and as people come in the front door, they're greeted by the guest services representative. That's their main role, is to greet people as they come into the hospital and to help navigate them through the facility. We also have a customer service representative, and their main role is to answer the main line of the hospital. But they also share responsibilities. When one's not busy, when one's busy, the other one helps to do the other role.
Mm-hmm. And they're both located
At
right
the front
inside.
desk, right as you come in the main entrance.
Well, that's convenient, and I'm sure that makes a good first impression.
We want it to.
On our guests.
We want it to.
Well, great. I hear there are many new customer or patient-friendly features at the hospital. Can you talk a little bit about some of those?
I can. Private rooms, which we're very excited about.
I bet.
Every room is private. We have flat screen TVs in the rooms.
Wow.
We also have wireless internet throughout the hospital.
So the patients can bring their laptops?
They can.
Wow.
They can. And you can sit anywhere in the hospital and use your laptops.
Awesome.
We also have a business center, a beautiful chapel. It's really beautiful. And then also our health resource center.
What is that?
The Health Resource Center is a place where people can go and use the computers right now to look up conditions that they may have. And in the future, what we're hoping to do with that is to have medical journals and books, and also to be a resource as far as the computers are concerned, so there's a reliable resource for people to investigate. Say, for example, diabetes. If they're diagnosed with diabetes, they could come in there and they could look through our journals and books and also look on the internet to find out more about their condition.
Now, do physicians use that area also?
They can. They can.
Well, good. That sounds like a great plus for the hospital.
Absolutely.
I know you didn't have anything like that in the older facility.
No, we didn't, and we're hoping to continue to build it up so that it is really a great resource for not just our patient and visitors, but also for the community.
Well, good. Good information. Well, I want to change topics a little bit and talk about the dining area. I understand that it's really upgraded.
It is.
Tell me about a little bit about that and about something I've heard called on-call dining.
On-call dining. Let's talk about that first.
Okay.
On-call dining is the ability for the patients to call down at any time during the day from 6:30 in the morning until 6 p.m. at night, and they can pick out their menu.
Wow.
I know, it's a wonderful thing.
Sounds like a restaurant.
It really is kind of like that, in a hotel almost. And if they pick things that are not on their diet, then the dietitian will look through that, and they'll make sure that they're getting the appropriate diet. But that's also a learning tool for the patient, for them to be able to see what they really can have when they're on a specific diet.
I never thought about the learning piece of it.
So that's really a great thing. So very popular. And then the cafeteria is it's beautiful. It's a scatter system where you can go around and get the grill, hot food, salad bar, desserts. So it's really a wonderful addition to the hospital, and it's also open to the public.
Oh, well, that'll make it really nice that, you know, the public, it all give them something to do while they're there also, maybe visiting a family member or something they can utilize.
It's very popular.
Great. Well, in addition to that resource center that you talked about, the health resource center, I understand that you have a business center. And what is in the business center?
The business center is like when you go to a hotel and you want to use the computers there, or you bring your own laptop in. We have computers in the business center that visitors and patients can go in and use the computers. We also have telephones there, and they can also use the fax machines in there. So it's, you know, if you're there in the hospital and you're visiting someone or you're there for a little while, you can actually go in and use these services just like in a hotel.
Wow. This is just, I can't believe all the changes and how different it is. And all these new guest features and services, they sound remarkable. What's in the future? Well, I mean, it sounds like you've got mostly everything. What do you hope to do? What's the next?
What's the next best thing?
Yeah.
Well, we want to continue to improve the Health Resource Center so that it really is an asset to the community. And the guest services at the front desk, we're working on developing more resources for the public and for the people that come in so that we're giving them local resources in addition to what we're already providing.
Wow, that sounds great. That sounds great. Let's talk about volunteers a little bit. I understand that you have several.
A couple, yeah.
How many volunteers do you currently have?
Well, about maybe 6 months ago there were 60. Now we have 100.
Wow.
So we've really increased with anticipating the need in the new hospital. So we're around 100. We're actually having a meeting. We have meetings once a month where we bring new people in that are interested in volunteering. It's an informational meeting. And we talk about the opportunity for them to come in and work with us on things that openings that we have.
So there are many more opportunities within the new facility for volunteers.
Absolutely.
Than there were, say, in the old one.
Absolutely. I think we have a great volunteer organization and wonderful people given lots of time, and we are looking for other people that want to do the same thing.
Well, I know I've met some of your volunteers, and they do a remarkable job. I think they're just such an asset to the facility and to the community.
And they feel that, you know, people come to serve, and that's exactly what they're doing, and we're very proud of them and very excited to have them there.
Well, I'm sure you are. You mentioned the gift shop. Well, I want to talk about my favorite thing, which is shopping.
Mine too.
So, and I was in the gift shop, and it is amazing. You have some of the most beautiful things. Talk to me about the gift shop.
Well, it's 4 times larger than the gift shop was at Brunswick Community Hospital. So that alone tells you that there's more room for other things. We have jewelry and handbags and food items and wonderful decorations and just all kinds of things. We're open from 9 a.m. until 4 p.m. Monday through Friday. We are looking for volunteers to come in and help us on the weekends because we would like to be open on the weekends. We also are providing fresh flowers now, fresh flower arrangements and plants, so that's really great that we're able to do that. So people can either come in and pick them up as they're going up to the patient rooms or they can call and order them.
I was going to ask you if we could call and order flowers.
Yes, we're working with a local florist just for you. So they're right across the street from us, which makes it convenient. And if we have special orders, then they'll bring them across the street for us to deliver them to the patients. And then we can deliver them to the patients ourselves. And we can put balloons in them. We can make a special gift for someone if people want to just call in. And we can do credit cards over the phone. So that works out really well. Should I tell you that?
So we can just pick up the phone and call you, and just and you can take our credit card. It's just like shopping in town.
It is. Yes.
Well, it is beautiful in there, and the displays are very nice. It's just what a great thing for Brunswick County. Well, Deborah, I know we've talked a lot about different jobs in the hospital that the volunteers can do, but I'm sure there's many, many more. Let's talk a little bit more about what specific positions they fill, the roles that they fill, and how that works.
In our surgical weight room, we have several volunteers that work in there. They greet the patients as they come in, and then they help them to navigate through their day. in the surgical services. And so it's really great that we have them there. We also have people that work in the back, volunteers that work in the back, that help to transport the patients out after they've had the surgery.
Oh.
So they're there to do that and help put up supplies and things like that. So there's a lot of assistance that we give to our surgical services area.
Wow, I didn't realize that.
Yeah.
And when you say they transport patients, like after you've had the surgery, they would like push the wheelchair out with the patient?
They do.
Oh,
They get training. And so they're able to do that. And we have a lot of retired nurses that come in and help us. In fact, I think that the majority, a lot of them that work back there are retired nurses, but we do have others that help out, that just want to, that's what they want to do. They enjoy that part.
They probably miss that interaction with
They
their
do.
patients. Well, that's a win-win for everybody there.
It is.
Yeah. Well, is there anything, if I wanted to be a volunteer but I didn't really want to come into the hospital, is there something I could do?
Yes, there is. We have people that input data. Volunteers, home volunteers, that's what you're talking about. Yes, we have lots of opportunities for home volunteers. They do blankets for us for babies and also for older adults. In fact, today we just had baby blankets and adult blankets brought in, and it's a wonderful thing to see these things from the home volunteers, that they support us in this way.
Oh, so they make items that we might use at the hospital. They make those at home, and then they just bring them in? And
They do those, baby hats,
Oh.
little teddy bears.
Uh-huh.
So, and we have wonderful support from our home volunteers. They're really a great part of our organization. So when I say we have 100 volunteers, those are the volunteers that come in to the hospital. As far as home volunteers, I can't even begin to tell you how many there might be of those.
Really? They're kind of like the unsung heroes.
They are. They are.
Well, that's amazing. We touched briefly on the chapel. I'd like to talk a little bit more about the chapel and the chaplaincy program. I understand you have a very active group of volunteer chaplains at the hospital.
We do. Our volunteer chaplains that's a wonderful group of people. They're very dedicated. We have one chaplain that comes in every day to see our patients. And then we also have a chaplain that's on a beeper. And so that chaplain they are called in at any time, day or night. They come into the hospital as they're needed. So that's really a wonderful thing. And they're very excited about the new chapel. It's a beautiful place, glass bricks. It's wonderful lighting that comes in. So they're very excited about having that also.
Well, that sounds wonderful. And you say there's one on call. So if there's an emergency, you would be able to call them and they'd come in and administer to our family or our
Yes.
patients.
And also if there's a specific need, like this weekend there was a need for a Catholic priest, and so we were able to call someone in specifically for that reason. So
that's great.
Yeah, so
Great.
they're really, like I said, they're very dedicated, and they come in whenever they're needed.
Great. Well, we have viewers out there who might be interested in the volunteer program, how would they reach you?
They can reach me by calling me, 721-1484. And we have started a new process with our volunteer orientation because we had comments about the orientation process being really a lot of information all at one time. We've decided to have an informational meeting. So once a month we have an informational meeting. The volunteers are asked, people that are interested are asked to come in and come to this meeting, hear about what we do have to offer for them, give them a brief tour of the hospital, and then I set up an interview with those that are interested in filling the positions that we have available. Then after the interview, then we start the process of getting them in, doing the orientation specific to the area that they may want to work in.
Great. Great information.
Thank you.
Well, thank you so much for being with us today. It's been a pleasure to have you, and I look forward to seeing you in the gift shop.
In the gift shop. Thank you.
You're welcome.
Thank you for allowing me to be here.
You're welcome. Thank you for tuning in to Health Watch on ATMC TV, brought to you by Novant Health. I hope this information was beneficial for you and your family. And if you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. I would also like to encourage you to participate in Novant Health's monthly Focus on Health seminars. These seminars are held on the third Thursday of each month in the Brunswick Electric Community Room. During these seminars, local medical professionals discuss health topics of interest and answer your specific questions. Please check the local newspapers for additional information or visit brunswickcommunityhospital.org. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.